Hello, everybody. Good afternoon. My name is Noemi Custodia Lora, and I'm the Vice President of Lawrence Campus and Community Relations. And it's a great pleasure for me to be here as a moderator to this fantastic event, the COVID-19 vaccine at the workplace. Before starting, few housekeeping items. Number one, this webinar will be recorded and you will have access to the video and also to additional important resources that will be sent via email. Everybody will be on mute until the time of Q&A, but please feel free to send questions through the chat room, and Alexandra and some of the teams behind the scenes will be monitoring that and will bring them to that section. So this task force, the COVID-19 task force, is a group from the Lawrence Partnership that includes community leaders, nonprofit organizations, private corporations, Northern Essex Community College, and representatives of the city of Lawrence. The ultimate goal of this task is to end the spread of COVID-19 in our community. We have been working together to align our efforts and impact during meetings, sharing information, resources, and most importantly, identifying and collectively find and facilitate solutions to end the current crisis. Through this process, working directly with the community, we learned that there are people that are hesitant to get vaccinated. And in an era where the internet is a default place for information, you can imagine that everybody sometimes think that they're an expert. Just before this event, I check Google and see how often the phrase COVID vaccine is searched. And it's actually every second, 1.2 billion times people search that word. So you can imagine how how much people are interested in this type of information. And at the same time, when you look into the internet, there is as much reliable information and there is also misinformation. And it is the misinformation that causes the mistrust and the fear to get vaccinated. The COVID-19 task force is conscious of that. And one of the biggest efforts that they have is to facilitate education. We're funding Spanish language multimedia campaign to educate the population with actual facts. Our campaign is called COVID-19 is safe, effective, and free. La vacuna COVID es segura, efectiva y gratis. And this campaign is running through the radio and print ad, posters, interview session with medical experts, and engagement and support of social media influencers and also trusted community partners. There have been many studies looking at why people are so hesitant about getting vaccinated. And at the core of that is the misinformation. And what makes people to change their mind often enough is having the information coming from the trusted um, sources. And usually, what they consider the trusted source is their primary care doctors and other health professionals. And this is what we're doing today. We're bringing you experts in the field to talk about COVID 19. Our panelists include attorney Mike Rosen, partner at Foley Hogue, Dr. Goodman, Chief Medical Officer and Vice President, Medical Affairs at Holy Family Hospital and Haverhill and Methuen, Dr. Kelly, Chief Medical Officer at Greater Lawrence Family Health Center, and Dr. Haddad, President Lawrence General Hospital Medical Staff and Community Neurologist. I will be calling each panelist to ask specific questions, but please, the rest of the panelists, feel free to jump in and add your expertise. So I'm going to start with Dr. Goodman first. Dr. Goodman, the first question that I have for you is, did you get vaccinated?
Naomi, yes, I have been vaccinated, fortunately.
Good, that's good. And we understand that they're concerned about the safety and efficacy of the COVID vaccine 19. Can you explain us the different types of the vaccines that are available here in the United States and how they are different?
Yes, thank you. That's a good question. And I also want to thank the Lawrence Partnership for putting this on and allowing me to speak. Um, Currently, there are three types of vaccines available to us in the United States, and they all share the characteristic that they help us produce the spike protein that we see on the coronavirus. Well, we are all familiar with the cartoon picture of the circle and the spikes coming out of it.
Mhm.
The Pfizer, Moderna, and Johnson & Johnson vaccines cause our body to produce that spike protein and stimulate an immune reaction. And it's a very safe process. And I'll explain slightly how the different vaccines differ. But the vaccines are safe, but in fact, just about now, about 500 million vaccine doses have been given around the globe, nearly 500 million doses. And many lives have been saved, and only generally minor side effects are experienced. And as far as we know, no deaths have occurred as a result. We certainly would have heard about those bad reactions given the social media and the internet. So we know they're safe and they keep us safe. The Pfizer and Moderna vaccines are a relatively new type of vaccine. We've heard the term mRNA. Those vaccines are small, oily, or fat-covered molecule of mRNA. And this has been in the works, although we've only heard about them over the past year because of COVID. The science and technology underpinning this type of vaccine has been in the works since 1995 or so. Scientists at the University of Pennsylvania have been working on it since the 90s. But fortunately, that work was already in place and has been available to us and helped us get the vaccine to people and into people's arms in an amazingly short period of time over the past year. In contrast, the Johnson & Johnson vaccine is more similar to what we've seen in the past. It is a DNA vaccine that the DNA is delivered in a weakened virus, has nothing to do with COVID. And it again stimulates our body to make the spike protein and create the immune response. They're all, it's important to know that we've heard different numbers about their effectiveness, but they all completely prevented death and prevented hospitalization when they were studied. There's some minor variation in terms of preventing the minor manifestations of COVID, but they all completely prevented death and hospitalization. So all in all, we have tremendous experience. They're very well tolerated, minimal adverse effects, and they keep us safe and allow us to get back to normal. Thank you, Naomi.
Thank you. Something that you mentioned that is very important, and again, for the people that are here that will be eventually sharing the information with the rest of the people that you know, is that there is one of the rumors that was around is that this was a new technology and we have not tested in humans before. And the fact that this has been done already since the 90s is something that we should share with people that are hesitant to the vaccination, because that's one of the rumors that are around there. So thank you for sharing that information with us. Next, we have Dr. Kelly.
Hello.
Yes. So the first question, have you been vaccinated?
Yes, indeed I have. And I'm very happy to say that I have. I've had the great opportunity.
Did you get any side effects?
I actually didn't. I may have felt a little tired, but I have to say I stayed up a little late that night. So it could have been just because of that.
Sure. So my question is actually related to that. What are the most common side effects of the vaccine?
Yeah, that's a great question. So the side effects from the COVID vaccine really happen because the body's responding to the vaccine. It sort of activates our immune system. And so those side effects are very similar to what we might feel when our body is activated, when the immune system is activated when we get sick. So we might feel a little fatigue. We might feel like our body aches a little bit, maybe a little headache or feverish, some nausea. The other thing that can happen is some pain right at the site where they inject the vaccine. And these symptoms, usually only last about 1 or 2 days, and then it's completely gone, and they leave as fast as they came.
That's good. And there have been rumors about severe long-term effect on the vaccination, including that could make people sterile. In your expert opinion, how do you respond to that?
Yeah, that's a great question. So, the question about whether it makes people sterile, I'll just share that these vaccines are being monitored regularly, and anybody who has an event that occurs puts them into the V-Safe monitoring system. And there have been over 30,000 pregnancies of people who have been vaccinated. That's some of the data that came out in early March from the CDC. And also there have not been any complications or issues with babies associated with the COVID vaccine. Over 200 babies have been born. So this is really good news. Not only do we have the knowledge that we don't think that it will affect the pregnancies or cause sterility, but we've actually had many babies born and many pregnancies that have occurred.
And my next question is actually related to that. So what are your recommendations for pregnant women, women that are trying to become pregnant, or even women that are breastfeeding right now?
Yeah. So that's a great question. And this is something that really pregnant women, I would encourage them to discuss with their medical provider. So I think one of the biggest concerns for pregnant women right now is that if they do get COVID, they're actually at high risk for getting severe disease. They're at higher risk than other people. So they are really good candidates for vaccination. And when we're thinking about whether to get a vaccine or not, preventing infection is a huge part of that, but I know that there are a lot of other things that people are considering as well. And many may ask if it causes problems with their pregnancy or if it's going to cause problems with their baby. And I think that's where this monitoring really shows us that with all the people that have been vaccinated, we have not seen any risks associated with the vaccine. For pregnant women or for their newborns.
Oh, that's great. And for the women that are breastfeeding will be the same case. There's no risk, or there should not be any concerns.
That is correct. And we actually often in primary care vaccinate the mothers so that the baby can be protected. And sometimes even some of that can pass from mom to baby, that the protection can help the baby as well when the mom is vaccinated.
Oh, so you can have passive immunization then.
Sometimes that does occur. And I think that we are thinking that might be possible with the COVID vaccine as well, which would really help us.
That's fantastic. Thank you. Dr. Haddad, next questions are for you. The first one is, did you get vaccinated? Oh, he's on mute. Can somebody unmute Dr. Haddad? Yes.
Okay, thank you. So now that you can hear me, thank you very much for having me here. It's a pleasure. I should say, first of all, that we should all be thankful for being here today after this catastrophic year that we've all been through. This is deserving of celebration. And it is in that setting that vaccination becomes so critical. And it's truly a miracle that we've had these vaccines come so quickly to our aid. And to use them is absolutely needed, necessary, and it overtakes any risk that you may be thinking about, aside from a major allergic reaction that some people very rarely could have. So the general answer regarding vaccination is yes, yes, and yes. Even if it doesn't prevent transmission, which is still an open question, it does prevent hospitalization and serious illness. And we'll talk about more of this as you ask questions.
So the next question is about variants, COVID variants. And so when I explain to people about COVID variants, and I have a scientific background, I explain it as dogs. You have a Chihuahua versus you have a Doberman. But in your expert opinion, how did you explain to your patient what is a COVID variant? And then the second question is, do the current vaccines prevent more variants?
Yes, well, on the dog analogy, it would be more like a Welsh Corgi versus a Cardigan Corgi. They're both Corgis, but one has a tail, the other doesn't. So, they're still very similar, but there's slight differences.
Okay.
So these variants are still the same virus. So it's still a coronavirus. It's still the corona SARS-19, but there is an amino acid or a few proteins that look a little bit different. the virulence of this virus is related to the attachment to the body, to a certain receptor, which is called the ACE2 receptor, and that's where that spike protein is so good at attaching. And once it attaches, then it causes all kinds of havoc, which is, of course, much worse in vulnerable populations and people that cannot control the replication of the virus so that it becomes overwhelming. Or if they have too much of an immune response, that ends up harming their own body. So either of those two situations is very bad for the host. And actually not good for the virus either, because if the host dies, the virus does not replicate and it doesn't move on.
Yes.
So a very efficient virus actually doesn't kill the host. And those are the cold viruses that we see every year. So there's a difference between preventing death and hospitalization from preventing the virus from existing in any given community. So when you talk about variants, you can still protect against hospitalization and death because the majority of the proteins are shared and the vaccines are covering that. However, some of them will transmit faster. The virulence of the variants can vary, where it makes you sicker or less sick. And as this evolves, that's just part of natural selection. I mean, you're dealing with living organisms that are competing for who will reproduce faster. And this is the story of life right from the beginning. So viruses are very good at that. And some of them, they actually become friendly to us, others not so much.
Okay. And we also have learned that the vaccine, part of the hesitancy about getting vaccinated is a rumor of having a 5G tracking chip in the vaccine. And
Yeah.
and that the vaccine will alter your DNA. So how do you respond to those concerns to one of your patients?
Well, the DNA question is very easy and absolute because it's based on a concern that has some rationality. People think of a messenger RNA vaccine as something that's going to instruct your genes to do something that they were not supposed to be doing to begin with. And then they say, oh, that's going to be implanted in me forever, and I will no longer be the person I am. So I can imagine some people thinking that.
Sure.
And the more, distrustful you are of science in general, the more you think that way. And then, of course, you may start creating theories where somebody wants to do it because they want to make money on vaccines and all that sort of stuff. Then it gets into, irrational thinking that we really cannot stop. But if we think rationally, the messenger RNA has a very limited life. It only delivers that message for a very short period of time to the cells that will then express that protein on their own wall, so that they will have a little bit of the virus on them. And through the lifespan of that cell, the immune system will recognize it, and it will then begin not only producing antibodies, but also stimulating what we call cellular immunity, which is that you got these lymph cells that will carry that memory forever, which then gives you immunity for life, versus just an antibody that can become very low titer if you're not getting exposed to it again.
Sure.
But it does not change your DNA. It only gives the message to the ribosome, which is inside the cell, to make that protein. It doesn't even touch your DNA.
Thank you. And are there any medical conditions or reasons why a patient cannot be vaccinated?
Well, I want to get back to the 5G because that's the other story.
Yeah, the 5G.
So that I had to look up myself because I was curious, and I came across this. This was something that came out of Italy, I guess, right in the beginning, and it was almost a joke, but somebody plastered a diagram of a guitar pedal circuit into the vaccine site, and basically implied that this is a circuit of 5G emission of energy, and it's going to be somehow connected to this vaccine. So that's absolutely nuts. But it's been perpetuated just because, people like those sorts of things.
It's in the internet. It is
Yeah.
the internet. Thank you. Are there any medical conditions or reasons why a patient should not be vaccinated or cannot be vaccinated? Yes.
The only contraindication is a known severe allergic reaction. And by severe, you mean somebody that has to carry an EpiPen, that sort of reaction, which is you develop swelling in your throat, you can't breathe, or you suddenly lose your blood pressure. It's something we call anaphylaxis, which is an emergency. And if people have had that with any of the components that may be part of the vehicles or preservatives, they should not get the vaccine.
Okay.
Minor allergic reactions are expected. And this is why people need to be watched for 20 minutes, half an hour after each shot.
Yes.
Because they can be treated on the spot with an anti-allergic. But outside of that, this is not a live vaccine. A lot of times we worry about causing the disease by giving a vaccine. Some vaccines are that way, so folks that have low immunity cannot take them. This is not the case for this vaccine.
Thank you. The next question is for Attorney Mike Rosen. Mike, did you get vaccinated?
Naomi, unfortunately, I have not been vaccinated, but only because I'm not yet eligible. I am not a medical professional like my other fellow panelists. I'm just a lawyer, and I'm not old enough yet, but I certainly plan to be vaccinated as soon as I'm eligible to be vaccinated.
That's great. That's great. So some of the questions that we have here are related to labor laws. Can employers mandate or require employees to be vaccinated?
The answer is yes. Employers can mandate or require that employees be vaccinated. That was something that, there was some question about, some uncertainty about during all of the months where we were waiting for the vaccines to come out. But the federal EEOC, the Equal Employment Opportunity Commission, the federal agency, issued guidance to employers at the end of 2020 that makes very clear that employers can institute a vaccination program that essentially requires that their employees be vaccinated, with basically two exceptions or limitations. One is that an employer cannot require vaccination for an employee who has a disability, a medical condition that would prevent taking the vaccine. And I think that actually what Dr. Haddad was just suggesting is that that's going to be a very small, very, very small population of individuals who have a medical condition that would prevent them from being able to be vaccinated. But if an employee is in that category, that's a situation where the employer would have to consider some other kind of accommodation to allow the person to continue to be employed, and they would have to engage in a dialogue, a conversation with the employee to consider an exception to the mandatory vaccination policy. The second exception is related, and that is to accommodate an employee who has a sincerely held religious belief that would prevent vaccinations. So there are some people whose religious beliefs prevent them from being vaccinated. And if an employee says, I won't be vaccinated, I won't follow your policy because of it's against my religion, then again, in that situation, the employer has to consider accommodating that employee's request to be exempted from the policy and to engage in a dialogue with the employee.
Okay, and a follow-up question to that is, may the employer request a proof for the reason why she or he will not be vaccinated?
The short answer is yes. Certainly that is the case for somebody who has a disability, a medical condition that the person says prevents them from being vaccinated. Like any other kind of disability accommodation request, an employer is permitted to ask for medical documentation to support the person's assertion that they have a disability that prevents them from being vaccinated. So absolutely, you can ask for proof of that. With respect to somebody who has a religious belief, it's a trickier issue. You can inquire of the employee, you can ask the employee to better understand why they believe their religion prevents them from being vaccinated. But the issue of documentation isn't quite as clear. You can't sort of say, well, we want a clergy member to provide you with a note. So it's a little bit more limited in that circumstance.
Okay. And as employers, are employers liable for the risk of unvaccinated employees placed on other employees, patients, visitors, clients, for example?
So the risk is certainly greater. I guess I would put it this way. There's no law that is requiring that employers impose a mandatory vaccination program on their employees. But having such a program is certainly going to lower the risks that would come from having unvaccinated employees in the workplace. Essentially, those employers would continue to be in the situation like we have been in for the last year, in which for those employers that continue to have employees come into the workplace, whether they be essential workers and other healthcare workers, other kinds of workers that still had to come to work, there's a heightened risk, a safety risk to everybody, and that imposes on employers additional safety requirements that we've all been living with for the last year.
Yeah, and then follow up with that, what are the legal implications to a facility from the OSHA perspective if vaccines are not mandated by the employer?
So essentially, if vaccines are not mandated, from an OSHA perspective, you're going to have a greater risk in your workplace of ultimately of OSHA violations. That is workplace safety violations. That OSHA is the law that covers that. And those risks are decreased if the population has been vaccinated. If you have an unvaccinated population, then you're going to have to continue to impose all of the different safety measures that have been imposed. And I should clarify that for now, the CDC has indicated that employers should continue to maintain those safety measures that have been put in place: social distancing, other measures, other safeguards to minimize the potential for spread. Those measures are going to continue until the CDC issues new guidance indicating that the vaccinated population is large enough that we can start to alleviate, to lessen and reduce some of those safeguards.
And that would be even if all the employees are vaccinated, they still need to continue with those guidelines, correct?
Until the CDC issues new guidance on it. The issue is that even for vaccinated individuals, there's still a question as to what transmission risk they pose to others. But everybody expects that there's going to be additional guidance on that in the next several months, and the CDC will be updating the nation and all employers as to what would be permissible reduction of those safeguards.
Is an employee able to visibly identify vaccinated versus unvaccinated employees?
So the EEOC was very clear in the guidance that I just mentioned that employers can require proof of vaccination from their employees under a mandatory vaccination program. So if an employer institutes a program that says we want everybody to be vaccinated, as part of that, the employer can require that employees present the card or other proof that the person has actually been vaccinated. Making that visible on something like an employee badge is problematic under the law. And I would, for now, until the EEOC says that that's okay, I would suggest against it because it raises issues about personal medical information being made public. I do think, and we've been working with clients and recommending that if you are able to, as an employer, to essentially code the person's access card. If you have an access card or a badge that enables people to come into your facility, for example, you could code that card to only provide access to people who have actually been vaccinated. So that would be one way to sort of use the information that you have to protect your workplace.
Okay. Are there any legal concerns around offering incentives, such as PTO, to employees for getting vaccinated?
So minor incentives are perfectly fine. So something like offering PTO to employees, giving people time off, minor gifts like gift cards to people to provide incentives for them to be vaccinated, those are fine. It becomes a little more problematic if you're offering significant financial incentives like a bonus. And in particular, if you're penalizing people, if you're saying, well, we're not going to give you a raise, or we're going to, cut your pay or something like that if you don't get vaccinated, that would be a problem. But minor incentives are perfectly permissible.
Okay. And are there any recommendations for employers who would like to seek to set up a vaccination clinic at their workplace?
So the recommendation for that, it's still a little bit early, just because there isn't that much vaccine available for employers to be running their own vaccination programs the way many employers have done historically for flu shots, for example. But it is expected that we will reach a point, hopefully in the fairly near future, where there will be enough supply of vaccines for employers to run their own programs. And the recommendation there is to engage a reputable vendor to run the program for you, not to try to do it yourself, but there are vendors who will, through insurers and others, who will be able to run the program for you. And then those vendors should confirm that they are running the vaccination program consistently with guidelines that the National Institute of Health and the CDC have issued for employer-sponsored vaccination programs.
Thank you. Now, next question is for Dr. Goodman. Dr. Goodman, we understand that some people are still waiting for a specific vaccine. And again, this goes back to everybody Googling like which vaccines they want to get. What would you recommend to your patients in terms of something, that type of practice?
Thank you, Naomi. That's a good question. I would, in a nutshell, I would recommend my patients and anybody who asks to try to get the first available vaccine. As mentioned earlier, they're all effective in preventing hospitalization and death. And at this point, because they are still in relatively short supply, it's virtually impossible to pick and choose what vaccine you will receive. There are theoretical advantages and disadvantages for between them, but all in all, they're all effective. And at this point, it's only a theoretical question. I think maybe a sophisticated consumer might be able to get themselves an appointment where one is known to be offered versus another. But I think that's really not feasible for most people. So it's a theoretical question. And the answer to that theoretical question is get the one that's available the soonest. And that's what I recommended to my mother. And I didn't take any, I didn't hesitate when I was offered the vaccine that I received. But Noemi, I would like to just respond to the question you asked earlier, but because it ties in also to your question here about hesitancy. Some people, they investigate their vaccines and they hear about the nanotechnology associated with the development of the mRNA vaccines. And that does scare people because it sounds like high tech, something's going in your arm. The nanotechnology is just the description of the little oily ball that surrounds the mRNA that's being injected to protect the mRNA so it's not destroyed as it's injected. So nanotechnology is also one reason that people hesitate to get the vaccine, and they think it's somehow going to be taking control of their body and so on. But that's nothing to be worried about. It's something to be impressed by, that it's available, and be thankful and grateful that it is available.
Thank you.
Thanks.
Dr. Haddad, next question is for you. The vaccination has been shown to be an essential tool to stop the spreading of COVID-19. How many people you feel that will need to be vaccinated in order to have an impact in protecting us from COVID-19?
Well, the standard answer to this question is that you need about 7 out of 10 people in a given population to be able to essentially kill the spread of the virus and make it disappear, because you won't have enough people to use as host to replicate, and therefore it will self-annihilate itself. And the reality is that I don't think that on this situation, we are capable of doing this forever, because this virus is mutating at a relatively faster rate than what we initially thought it would. As you all know, there are now variants from UK, from Brazil, from Africa. Reading the paper today, there's a new variant in India now that appears to be different by 2 antigens on that case. So this is a pretty resourceful virus. So the answer is that you want to have a population that is immune to serious illness from this microbe. And if you achieve that, that's really all you need. Because the reality is that we live with microbes all around us.
Sure.
And some of them they live inside of our gut, and they're very good. So the idea that we have to be on a sterile environment with no viruses, it's just not a reality. But so the answer is that in Massachusetts, if you say you have 7 million people, and that's the current population, the goal would have to be 5 million people vaccinated. And I think that can be achieved.
Thank you. Next question is for Dr. Kelly. Dr. Kelly, is the vaccine available to undocumented individuals?
So yes, the vaccine is available to anybody who would like to receive the vaccine. So yes, definitely.
And can you share where employers can refer employees to learn if they are eligible for the vaccine now and how they can get vaccinated?
Yeah, so at the Greater Lawrence Family Health Center, we can definitely take all those questions and also take people in for vaccine at the health center. So feel free to contact us.
And I believe there's going to be information related to the different resources that we will be sharing with people. So feel free to contact the Greater Lawrence Center. This question is for everybody in the group, and is anybody that would like to answer. So this one came through the chat. And the question is, what does it mean to be fully vaccinated if you get 2-shot vaccines versus 1-shot vaccine? Will it protect you?
I'll go ahead and take that. So yeah, I think that's a great question. So being fully vaccinated is when you've had 2 weeks since your last dose or your final dose of the vaccine. So if the vaccine requires 2 doses, you will be fully vaccinated 2 weeks after your second dose. If the vaccine requires only 1 dose, you will be fully vaccinated 2 weeks after that 1 dose.
Thank you. And the other question that I have, again, and this is, I would like each of you to share your insight, is what is the biggest concern that you hear from your patients and clients regarding the vaccination, and how do you think that we should address that? Like, what answers you will provide them to ensure them that is efficient, safe, and free, and encourage more people to vaccinate themselves?
I could take that, Naomi.
Sure.
It's usually a few concerns. One is that the vaccine was rushed out and how could it be safe? But when I explain to them and they read that the mRNA science has been worked on since the late 90s, and Moderna has been in existence for a number of years, far, not just the past year doing the work on the science, people become reassured. It's just that because the science was available and technology, they could adapt it to the COVID-19 infection and put it out in such a miraculous period of time. So the rush is a concern for folks. People are sometimes concerned about the side effects, which are comparable to other vaccines, especially the shingles vaccine. Some people who may have had the shingles vaccine, the second dose of the shingles vaccine is very similar to what some people experience with the COVID vaccine. Again, these are just temporary side effects that resolve, and they're nothing like experiencing, full-fledged COVID disease. So that's my experience, those two.
Any other panelists would like to also address the comment?
I'll go next, Noemi, if I may. I advise employers. That's sort of what I do, and I think many of my clients are continuing to struggle with the basic question that you started off with me, which is whether once the vaccine's available for everybody, whether to require employees to be vaccinated, whether to make it mandatory or whether to make it an encouragement. And if they encourage it but don't require it, what do they do if people don't want to come back to work? And so lots of employers, I think, are sort of wrestling with whether to make it a requirement or whether to simply encourage people and provide incentives to people. And I think a lot of companies are still struggling with those questions.
Okay.
So
yeah.
from my practice,
Sure.
I have a kidney practice in the area. I'm a nephrologist, and a lot of my patients are somewhat vulnerable to begin with because of their chronic diseases. So a lot of the questions you get are, first of all, is the vaccine going to hurt me? And there's always this idea that a vaccine somehow can carry the disease. And this is just historically, what people understand from what vaccines are, because that in the beginning, that's what they were. They were inactivated microbes that were used to provoke an immune response. So I think we do have to respect that sort of concern and address it in a way that people can understand. And the whole idea that Dr. Kelly put out, where the existence of a reaction is actually desirable, it's an important concept also to share with patients. If you have no reaction at all to the second shot, you wonder whether there's been actually a good immune response to that vaccine. Because part of what causes you to be sick is the immune response to any infection you may have. And it's that interplay that will give it a flavor. For the same disease in different patients, they may look very different. And it's not about the microbe, it's about the way they respond to it. So people don't quite understand the role of their own immunity and how important it is. And this is a good opportunity to educate people on what that's all about.
Thank you. Sorry, yes.
I would also just add that I hear a lot from patients wondering specifically for them personally, is this vaccine the right choice for them, given the medical problems that they have? And I think one of the things that's very striking to me is that the people who are more vulnerable and have more medical conditions are actually the best people to get the vaccine, because they're the ones that are at higher risk for being hospitalized and death. So when people have medical conditions, unless they've had a severe allergic reaction, they're actually great candidates to receive the vaccine. And I would also say that the more people that get vaccinated, we talked about this a little earlier, but all the variants that are going around, the less this virus gets a chance to replicate itself or make more and more copies of itself inside people, the less that occurs, the less it gets a chance to create new ways of infecting people and new variants. So I think one of the things that we want to think about is, in order for us all to get back to life as we knew it before, we need more people to be vaccinated, and that will actually bring less possibility for this virus to find new ways of infecting and new ways of making people sick.
Yes. So at this point, I'm going to be opening it up to the Q&A section. And there's several great questions here on the chat, and I would like for start with Raquel Quesada. She has a question related to individuals with disability. Raquel, are you? I don't know if she can be on mute for this part of the. Can you unmute, Raquel?
Yeah, I'm here.
Okay, so Raquel, could you please ask your questions to the panelists?
Yeah, most of the parents, they've been asking me, why only an individual under 16, over 16, they can get the vaccine. And some of them, they know that only if you have Down syndrome can get the vaccine no matter what. So why is that open to all individuals with disability? And the other question will be like, what is the procedures that we're going to do to educate the Latino community? It's two questions open to anybody. What will be the procedure to educate the Latino community, which I see them the most concerned about the vaccine? I did it myself. I'm a mother of a child with disability, and I think that was the best decision that I can ever have for my son to protect him. So thank you.
Sure. So anybody from the panel would like to answer her questions?
Sandra?
Sure, I'm happy to address them. So first of all, why 16 and older? And that just has to do with who they started with the vaccine trials. Right now, they are actually starting vaccine trials for younger kids. So soon, I hope that we will be able to have vaccine available for the younger population. That was just the place where they started to make sure that we can make sure that the vaccine is safe and was effective. And so now those trials are going on, and I hope soon that my kids will be able to be vaccinated as well. And the disabilities, so with Down syndrome, I am not sure exactly why that was the disability that was chosen, but I imagine partly because there are a lot of other heart and other issues that come with Down syndrome often. So there are a lot of other chronic medical problems associated with that. But I do think, again, that there will be more availability of vaccine for younger kids and those with disabilities once we get some more of the studies out and the trials finished. And then in terms of education, if anyone has ideas, we'd love to hear them, but we're doing a lot of education. We have had lots of town halls and Q&As and sessions with the local faith leaders, for example, in Lawrence. We've done quite a few video Q&A sessions. We've paired with We Are Lawrence to be able to do that as well. Lawrence General has put out a lot of educational videos. They are available on our websites. We're trying to put them out on places like Twitter as well. We know that not everybody goes to access those, so we are planning on also having people go out into the community and finding places where people can have a discussion and having someone like a community health worker go out and help with that education and just be there to answer people's questions, because can be a difficult decision and one that people are wrestling with a lot.
Yeah, and I would like to add that also Alexandra from the Lawrence Partnership, she had been coordinating going to different radio shows in Spanish with medical doctors that they also bilingual and open it up to the public so people can actually answer questions. So there are different ways in which the information is being traveling right now. At the end of the day, we have to make sure that, Raquel, as you said, we need to reach out as many people as possible in Spanish and also bring the right information with the right people that they can trust, that can deliver the information for them. So all of that is being considered. We have a question here for Dee Caldwell. Is the person, Dee Caldwell, is that person here? Can you please bring the question to the group?
Hi, that's me. I'm Danielle Caldwell. Hi. Thank you for having this panel and all the panelists and having this today. I really appreciate it. So I work in HR for a company in Haverhill, and I'm just curious if we are not mandating it, but if most of the people are choosing the option of getting vaccinated, what is the threat of having someone come back into the workplace who is not choosing to be vaccinated, but is still in the workplace. Thank you.
So there's a medical aspect to that question and an employment law aspect. Dr. Goodman, do you want to start?
Yeah, that question sort of indirectly gets into the concept of herd immunity. Theoretically, first I'll try to keep it simple and answer your question. There's less risk to the folks who are vaccinated because of that person's presence, but there is risk to those who are not vaccinated, so who are at the work site. So, you know, if you think about it, if 99 people out of 100, if 100 people work there, 99 people are vaccinated, and the only person at the work site is that person you referenced who's not vaccinated, then the virus isn't going to spread and it's going to be extinguished, right? The person will become infected eventually or not, but then they'll get their own immunity and it will not continue. That's the beauty of herd immunity. The problem is if only 50% of the employees are vaccinated, then you can see that the virus would bounce around and go from the person who brings it into the work site, and it will infect other people and then infect somebody else. So I hope that gets to your question. That's the benefit of herd immunity. And you are not only protecting yourself, but you're protecting your family. You're less likely to bring it home from the work site. And ultimately, you are protecting that person for some reason who doesn't get vaccinated. So yeah, that's the idea behind that. Thank you.
Yeah, and I would just add that in terms of the sort of employment law, HR aspect of it, you know, then you would potentially have people who are contracting the virus in your workplace. And you know that there's some risk of that, that puts you in a position where you're theoretically dealing with some liability issues. So you want to try to minimize those.
Another question. This one is from Tina Conlin. Tina, you around? Actually, you are on mute, I guess.
Oh, here I am. I don't have my video on though. So we have a number of employees who are working remotely. They've been working remote for a year, and at some point we're going to bring them back. Some of them are not enthusiastic about getting the vaccine, and they're afraid to come back into the work environment. So if they refuse to come back in and sort of give us pushback, is that cause for termination if they're unwilling or, you know, to come back? Do we have to accommodate them?
Yeah, I think this one's for me, Ms. Conlin. Yes, theoretically, you could say if you're not willing to come back and you don't have one of these narrow exceptions that you would have to consider accommodating, then you potentially could say those folks who refuse to come back, who don't have a medical condition that prevents vaccination and don't have a sincerely held religious belief, and who are insisting nonetheless that they get to continue to work from home, you potentially could say, well, you have to choose. And that's the issue that a lot of employers are grappling with right now, whether to have that very hard and fast policy that says, no, you don't get, you know, if you don't have a medical disability that prevents vaccination, you don't have a religious belief that prevents vaccination, we're going to require you to come back. Or are you going to make it more permissive and then potentially have a lot of people who are working remotely who would just prefer to continue to do that? That's the conundrum for employers. You can choose either of those. There's a kind of a philosophical decision for employers to make.
Thank you.
And then we have a question from Heidi Wieder.
Yes, hi. So I was just wondering, how long is the vaccine effective for anyone who is fully vaccinated? I've heard different amounts of time frames as to how long it's really effective to a person.
Cat's trying to answer.
I know, sorry about that.
The cat may have a better answer than we do.
Yeah, by the silence, you know, nobody knows really.
Nobody knows yet.
Okay, that's why I just figured I'd check on it to see if
But
anyone.
I think at a minimum of a year, I think we can all agree with that.
Yeah, okay, thank you. And my cat thanks you.
And then we have the last question for today, and this is from Laura Laura.
Hi, good afternoon, everyone. My question is, can my job fire me if I don't agree to get the vaccine?
I'll try to answer that. The answer is yes, unless you have you fall in one of those exceptions that I mentioned, that you have a medical condition that would prevent you from being vaccinated, or it's against your religion. In which case you would tell your employer that that's why you can't be vaccinated, and the employer would have to work with you to see whether there's some other accommodation that would enable you to continue to be employed. But your employer could say you have to be vaccinated if you want to continue to work here otherwise.
Okay, thank you.
So this was the last question. I want to thank everybody for participating. Special thanks to the panelists for being so generous answering the questions. The biggest message that I hear, and this goes back with the conspiracy theories that they are out there, is that the vaccine is not necessarily about not getting COVID at all, but actually preventing hospitalizations and death. And that's the message that we need to bring to people. Because sometimes people say, but I feel sick. Yes, but you're not going to get hospitalized, most likely, and you probably it's going to decrease the chances of death. So we should continue bringing that type of information for people. I encourage everybody to continue educating yourself. Help us, please keep helping us share reliable information to the public. Direct your employees towards resources where they can educate themselves. And please reassure people that the COVID-19 is safe, effective, and free. La vacuna COVID es segura, efectiva y gratis. Muchas gracias a todos. Thank you, everybody.
Welcome.
Thank you.
Bye-bye.
Thank
Thank
you.
you so much.
Thank you, everyone. Stay well.
Thank you.
Bye-bye.
Sandra, thank you. Great job. I was going to thank everybody else, but they're all gone. We'll thank them on the Monday meeting. But
Okay, great.
really,
I wasn't
really,
sure if we should stay on or not. So.
well, it's fine. I think we're good. But that was everybody was terrific. I think that was great takeaway from everybody. So I'm going to leave also, but stay safe and I'll see you soon.
Thank you to you guys for organizing. It was really wonderful.